Thank you, folks, for coming in. Thanks. I especially want to thank and I apologize, mainly the vascular division, because I had a great time catching up with old friends, and it's really a pleasure to come here. It's great. If there are any medical students, don't worry about it. This is not going to be on any exam in any way, shape, or form. For the residents, you're going to have nothing about this, but this may affect your life a little bit, I hope. And this is just sort of a hobby of mine. It's something that I sort of got into a few years ago, and I was telling Ron before that I was chairman of the department, rushing to be a visiting professor someplace, and training for a half Ironman, and the car to pick me up at the airport was 20 minutes late, and I just lost it with the guy who was driving the car because I had to get in my 6-mile run before I made it to dinner, and I realized, stop, you're burnt out, go slow, this isn't that important. So I started reading about it, and you're lucky here because Tate Shanafeld is sort of the guru. We'll talk a little bit about what he says. So let's start with surgical personalities. And I know one's going to admit they have a true surgical personality, but we probably all have true surgical personalities one way or another. So we have that take charge, kind of that natural leadership, I want to be in charge, strong leadership goals with focus. We'd like to be the go-to person, or as Jason might say, the franchise player. We have a can-do mindset. We can pretty much do whatever we want. And I love to ask people what they think about the surgical personalities. So I asked some of the OR nurses, and one nurse said, well, they're fairly narcissistic. You surgeons are narcissistic, and yeah, we are. And another one said, you're like spoiled children. And then I asked an older nurse who I knew from New Orleans, and I said, well, what do you think about surgeons? And she said, well, Dr. Money, they're like puppy dogs. I said, she goes, no, they're not like puppy dogs at all. And I said, what do you mean? She goes, well, a puppy dog stops whining when it grows up. Surgeons never do. So that sort of put it in perspective, what they think about us. But, we have great rewards. We have unique relationships with patients. We have a high level of trust and respect. And maybe not in the Palo Alto area, but in most of the rest of the world, our income are in the top percentiles. We are kind of the community and the workplace elites. It really is. We have a lot of respect, and it's something that we sort of enjoy. We're goal-oriented. Whether you believe it or not, most of you are type A. And do we have a need for achievement, or are we truly overachievers who just keep pushing and pushing? And this is something you have to think about. So are we into perfection or the pursuit of happiness? And there's a big difference, and you can't be perfect all the time, but you can pursue excellence a lot. So that's kind of the thing you have to think about. So there was an article written by a business school professor from Stanford and his daughter. And his daughter was a clinical psychologist, and they looked at high achievers. And they said they're driven to get results, they're doers, they're highly motivated, they crave positive feedback, competitive, passionate about work, and independent. Well, this kind of describes the surgeons. However, they said there are curses of being high achievers. And this is, if anyone wants to look it up, it's by DeLong and DeLong, and it's in the Harvard Business Review. And we're driven to get results. Nothing, nobody gets in the way. We have to check that box and move on. But we get caught up in tasks. Therefore, sometimes helping partners, colleagues gets in the way because you got to check the box. You got to do, as I would say, you got to do your scut list every day or you're just not happy. Well, we're doers. We believe, and sometimes rightly, nobody can do it as well as we can do it. But we don't delegate well. There's an art to delegating well, and surgeons aren't necessarily good at it because we don't necessarily trust they will do as good a job as we would do. And it's got to be perfect, right? We're highly motivated. We take all aspects of our job seriously. But this can lead to difficulty. Distinguish between what's important, what's urgent. We don't always prioritize. We want to get everything on that list done, whether it's a written list or a mental list. You got to get it done. And yes, we're surgeons. We crave positive feedback. We tend to ignore positive feedback and obsess over criticism. And I remember when I was a A PGY3, we were doing a case with the chair of surgery, and he turned to the chief and he said, "Doesn't that cholecystectomy look perfect?" And the chief resident, not being stupid, said, "Yes, sir. That was a perfect cholecystectomy." And then he turned to the PGY4, who was looking over his shoulder, and he says, "Doesn't the gallbladder?" And he goes down the list, and finally the chief resident says, "Why don't you ask the janitor if it looks perfect? You're the chairman of the department. What are you worried about?" Well, the chief resident got in big trouble for saying that, but we crave that positive feedback. Everybody's got to tell us how good we are. We're competitive, and yes, we are. And you can be competitive in a nice way, but sometimes you get overly competitive, and it can lead to false calibrations. And sometimes we do that. Oops, we lost one there. Intense highs can give way to crippling lows. One bad outcome can spoil the whole week. I don't know about the vascular surgeons here, but I look at carotid endarterectomies, and I've probably done 1,200 carotid endarterectomies in my career. And I've had, probably 12 or 13 strokes, and I admit it. It's 1%, a little more than 1%. Do I remember the carotids that didn't have problems? No. I remember the 8 out of the 12 people who had strokes. So I don't think about that I've saved 1,188 people from having a stroke. I think about the 12 who had the stroke. And you all think about that. That's just the way we're built. We're independent. We work well on our own. It's changing, but we still sometimes have trouble being part of a team. We need to be the captain of the team. And that's changing, and I think the next generation is going to be different, but us older surgeons, and I hate to say that, but I look in the mirror and I see no hair and what I see is gray. The older surgeons need to be the captains of the team. The practice of surgery, it's unpredictable. Rapid decision making, hard, arduous work, but we're passionate about our work and we derive pleasure from that. So let's look at some of the stuff, and most of this is from Tate, who is here now. He used to be at Mayo, Rochester, and he was sort of the leader in the field. I think he's written over 120 papers on burnout. So let's look at some of Tate's work, and I don't know, has he presented this to you guys? Has he given a grand rounds of surgery? Good, so I beat him to it, thank goodness. If you look at the number of hours per week surgeons work based on specialty, so the low is Gen Surg, and they're at about 59. Look at trauma, vascular, transplant. The average American who works, I'm not saying the average American who works outside of the home works 38 and a half hours a week. So look at where we stand. Oops, somehow went the wrong way. So the surgeon's dilemma. We're type A, we're competitive, we're perfectionists, we're driven, we're overachievers. What does all that lead to? Burnout. And the hours we work magnifies it, makes it that much worse. Think about that. You have all these traits that are good, but when you lead too strongly with these traits, they're bad, and you're working almost twice as much as the average American. So how do you define burnout? Emotional exhaustion, depersonalization, and a feeling of ineffectiveness or lack of personal accomplishment. Well, think about it. Everyone in this room at some point has gone through this, whether it's during training, first few years out, or kind of when you realize that I just feel horrible. I got to get through these cases because I want to go to the band concert tonight, and I'm going to make it to the band concert, so I don't care. I'm banging these cases out, and it's no longer a human being you're operating on. It's a case you have to get through to get to the band concert or the Little League game. So here's a number. This is it. 53% of surgeons are burnt out. At this point, half of the people sitting in this room are burnt out. General population, 28%. So what causes the burnout? Let's look at it. There's a lack of autonomy, work-life imbalance. We'll talk about that. The long work hours, long training periods, delayed gratification. We are really good at delayed gratification. We really are. And I was talking to someone yesterday about it. So you went to college, and it was Thursday night, and your friends who weren't pre-med, they were going out because it's almost Friday, so we can go out and have a few beers. And you're studying organic chemistry. And then it's Sunday, and everybody's watching the football game, and you're like, gotta go review a little bit of physics now. And then you go to med school, and no matter how smart you are, the first few years of med school, it's just a volume, you gotta put your backside in a chair and study. So you lose a little bit of life there, and then you become a resident. And, you know, when I trained, we were working 100 hours a week. You know, I lost life there. I delayed all that gratification, my friends who were like living normal lives, to become a surgeon. We're good at that. The other thing that puts us at stress is it's human beings we're taking care of. It's high-stakes human outcomes. One of the the things that we've sort of gotten into where I am, and this is sort of my research interest, is physical discomfort. 1 out of 3, and we specifically looked at vascular surgeons, 1 out of 3 vascular surgeons have pain after operating. And not just pain for an hour or a half hour, but 1 out of 3 go home that night and have pain. 6% of vascular surgeons have stopped operating due to the physical stresses of operating. Okay? We're doing a little project where we're putting little monitors on surgeons and seeing their body position during surgery. Open surgery, 2/3 of the time, people's neck is in a stressed position, a moderately or severely stressed position. How many surgeons do you all know who've had neck and back problems from this? Right? And what's interesting is those who have the physical discomfort have a higher rate of burnout. So the physical part of it also feeds back. Burnout in surgeons, 2008, 40%. 2013, 53%. I think the college is going to start another trial. We've tried to get in and get some of the physical stuff. The college is not helping us. If anyone here has good connections at the college, I'd appreciate it because we want to get the physical side of it involved in that with a few questions. But look at it. More than half of us are burnt out. Percent with burnout. And yes, it is dependent upon specialty. And what amazes me is that the lowest burnout is in the cardiothoracic surgeons. For the life of me, I can't understand that. As one of my partners said to me sort of off the cuff, they're such horrible people that they just don't get burnt out because they don't care. I like to think that's not true, and I hope there are no cardiac surgeons in the room. If there are, I'm sorry. But I think it's kind of predictable that the trauma surgeons are on the top. And if you look down here, and I wonder if it's changed now, because I know in the last 10 years, and you trauma surgeons aren't operating as much as you used to. You're kind of doing a lot more ICU stuff, but I still don't understand why the cardiac surgeons are at the bottom. This sort of bothers me as a vascular surgeon because we're number one, right? We win. We have the highest rate of suicide ideations, but, you know, no one's hello. And the transplant surgeons, I guess they're doing a lot of kidneys and getting a lot of people better because, you know, livers I think don't do as well as that, but they have the lowest rate. It's a very rewarding job. They don't want to off themselves. Right. One of the most important contributory factors is the work-life balance, and it really is. And I got a text this morning from a friend who said, you know, I've got 5 cases, I'm going through a divorce, and my kid has a concert tonight. What if I can't make the concert? I said, you'll make the concert. Don't worry about it. You'll make it, you know. You'll make it your business. You know, you'll steal the last 2 cases from the resident and just bang it out and go because this is more important. But work-life balance is important. And if you look at it, it's the female surgeons who suffer the most because they're torn. So 2/3 of female surgeons have had a work-life conflict in the last few weeks. And pretty much, I'm pretty happy that more than half of the male surgeons have had a work-life conflict. I mean, it's part of what's going on. We have to get home. It's part of what's important to us. If you look at it across specialties, you know, Gen Surg, you guys win. I don't understand it. And transplant loses. And I'm surprised transplant isn't up here because they just do, when the transplant comes, you do the case, right? But you look at it, There are the numbers. This is the most striking slide that I can show you. The rate of alcoholism in surgeons, and overall it's 15%, but look at this. 1 out of 4 female surgeons have an alcohol disorder. Think about it. I look at my department, and there's one who is clearly an alcoholic. Clearly. She doesn't even hide it. You go to a meeting, and she is pounding them down. And then there is probably another 2 who go home and discreetly do it. Think about that. 1 out of 4 female surgeons have alcoholism. So why should society even care? Why do they care about us? We're prima donnas, we make a lot of money, we live in this ivory tower and everything. Well, you go through all the things we discussed, and what happens? Well, when you get burnt out, the quality of care declines, medical errors increase, the cost of medical care increases. It really affects society. It costs a lot of money. It costs a lot of money when a surgeon gets burned out and either doesn't admit it to everybody or starts working below their level. So as a vascular surgeon, I like to kind of point out my own. So here we go. Vascular surgeons. This is the average work week for us. 61 and a half hours. Now it's interesting because I just read an article, I think it was last week, that was in the New England Journal, and they made the point that the average physician is seeing more patients than they did 10 years ago, but because of the EMR, they're going home to their family, they're having dinner, and then they're doing their billing and writing their notes and doing all that. They're taking the stuff home with them. So my guess is in 2018, the 61 hours is probably low because people are taking work home and doing it off-site at home. Average vascular surgeon, 2.7 nights on call, OR hours 20, burnout, work-home conflict 52%. And again, the average American works 38 hours a week. So what are the risk factors for burnout, especially in surgeons, but probably in everybody? Poor romantic relationship. Whether you're a man or a woman, whether you're gay or straight, whatever you are, you need emotional support. And if you have a poor relationship at home or with that significant other, it increases burnout. Work-home conflict increases burnout. Nights on call, yeah, even if you have a good night, you are still on call. Female gender increases burnout. Alcoholism, are they drinking too much because they're burnt out, or are they burnt out and then they're drinking too much? I can't answer that one. This is like from one of these throwaway journals that you get online, and it said even the models who are posing for burned out doctors are burnt out because they have to model every other day because everybody's discussing burnout. Burnout is chic. It's in. It's there. So what happened? Well, insurance companies exerted more control. Hospital administrators exerted more control. We're judged on matrix, not on patient care. Where I am, the Press-Ganey score matters a lot more than how good of a doctor you are. It's stuff that you can measure. The hospital wants to get in the top 10 of U.S. News and World Report. How'd you have a high mortality this month? We have become providers and not surgeons. And it's a big loss of autonomy. And I was talking to you about this yesterday. It hurts surgeons. The loss of autonomy hurts. I show this slide because I don't know what it's like in Palo Alto, but in Arizona, there are maybe 2 local pharmacies in the whole state. CVS, Rite Aid, Walgreens have come in and taken over the whole pharmacy business. So it's changed it. And to some extent, how many surgeons go out and hang a shingle? How many of your graduates go out into solo private practice? As one of my residents said from New Orleans, he said, I know that I will be picking cotton for someone else's plantation. It's just who I'm picking cotton for. I will be an employee. I will functionally do that. That's kind of where it's at for me now, and that's where it is for surgeons. This is the slide that makes everybody cringe, and probably everybody's seen it at someone else's talk, and it just explains it all. Orange is the growth of physicians. Yellow is the growth of administrators. Well, what can you say? They run the show. The clipboard people have won. And just to make you feel even worse, the doctors are not making as much as the administrators. This is an old article from the New York Times, but they're making a lot more money than we're making. You know, this is a great article that I read, and it was in a, believe it or not, a neurology journal, which almost embarrasses me to say that as a vascular surgeon, but they talk about how McDonald's has sort of set up a way to be successful and how it's happening in medicine. So no matter where you are in the world, if you go to a McDonald's, the hamburger is 9.483 centimeters in diameter. Well, you know, everything gets coded. Everything gets a length of stay, RVDU productivity. It's calculable. McDonald's has an assembly line, scripted interactions. Well, scripted interactions, my EMR template is scripted. I know what boxes I have to check. I have templates. I have standard order sets for patients. Everything is scripted for me. Control. The food is all pre-prepped, and if you notice, McDonald's intentionally has uncomfortable chairs so you don't linger. Well, pre-prep food, utilization review, formularies, it's all the same. It's control issues. And the EMR, as I said, people go home and do the work. The EMR has changed a lot of what we do. It's more important to do your medical records than it is to see that extra patient. And it slows people down, and it's really hard. One of the suggestions, by the way, in that New England Journal of Medicine article is that hospitals hire more MAs to scribe, so the doctor doesn't have to do it. They can just come out and click the box and move on. And when I started, and it was absolutely crazy what I did, but I would see 45 patients a day in my full-day clinic in New Orleans at Oxford Clinic, and I would just sign whatever the medical student or the resident wrote on the chart and move on. Whatever, do you write all that? And I'd sign it and move on. And I'd check a little piece of paper, and my medical assistant would put all the billing in for me. And it was great. I could get through 45 patients in a day. Can't do that anymore. So 71% of the surgeons would choose the same specialty again, but only about half would want their children to become a surgeon again. Interesting. So let's talk about happiness. So burnout and being unhappy are not identical twins. They're close siblings. They kind of look alike, but they're not really identical. So let's look at happiness. And how do you define happiness? Well, a psychologist, what people and why people feel happy. An economist, what people will give value to make them happy. What are they willing to give up to be happier? And a neuroscientist, what happens in people's brains when they're happy? And there's probably a huge cognitive neuroscience department here, and they've done the fMRIs on all these people. So the University of Chicago does a general society survey every other year. And they ask people a very simple question. How happy are you? Are you very happy? Are you somewhat happy? Are you not too happy? And except in times of great recession or times of war, it pretty much runs standard. A third of the people are very happy. A little more than half of the people are somewhat happy, and 11% of the people are not too happy. And this runs standard. It's amazing because they do this every 2 years, and they've been doing it for probably 55 years now. It's standard. This is the way people live. Well, let's look at surgeons. 25% of the surgeons were below the general population in happiness. We're just not a happy bunch. You know, it's just where we live. For those who are into it, here's an fMRI of a happy brain. And you know what's interesting? Most of happiness comes from higher thought centers. It's not the amygdala, it's the higher centers that make you happy. So how do you reach that that higher level of happiness? Well, like I said, people in good romantic relationships are happier. If your partner and you get along and it's a good relationship, you're happier. Healthier people are happier. People with faith and those who demonstrate altruism are happier. By the way, I read that and I started writing checks to all these charities. I just figured it would help me feel better. And believe it or not, and we'll talk about this, people with more money tend to be happier. So how can you, predict how happy you're going to be? And this is called hedonistic forecasting. So you predict, can you predict your emotional state in the future? If I get this, will I be happier in a year? And we're really bad judges on how good our future happiness is going to be. So this is from, he's a PhD at Harvard. His name is Dan Gilbert. And he is sort of the guru of psychology happiness. And you've seen him on a bunch of TV commercials. He's a little bald guy with a goatee and glasses, and he does commercials for an insurance company. He says, do you have enough money for retirement? And you put up the little yellow stickers. He's got a great TED Talk that he talks about this. So he asked a group of people, so if you win the lottery in 1 year, if you win the lottery 1 year later, how happy will you be? And if the average person is happy at 50th percentile, they said, well, the average lottery winner will be at 70th percentile. They'll be 20% happier than the average person. And if you become paraplegic on day 1, on day 365, how happy will you be? And they predicted that the average person who's paraplegic will be 23% happy. In other words, 27% less happy than the average person. Well, let's go to the people. Look at that. 1 year later, these are the real numbers. Everybody reverts to their baseline. People have a certain level of happiness, and we were talking about this yesterday. Certain people have a happy stat that's set at 74, when the average person's happy stat is set at 68. Certain people are happy, certain people are unhappy, but you go back to your baseline. You return to home page. And Dan Gilbert wrote about this, and it's interesting. So why is that? Well, half of happiness is genetic. Some people are born on the sunny side of the street, and some people are born on a rainy, cloudy day. It's just the way you're built. Your genes have done that. Isolated events make you happy, make you unhappy. And I'll refer to this a few times. I want a cheeseburger for lunch. I'm craving a cheeseburger. As they said, I want In-N-Out as badly as I can get In-N-Out. I go to In-N-Out, I'm happy. But how long am I really happy after eating In-N-Out and all those French fries? So I'm happy for a half hour. But that isolated event made me happier, but it's short-term happiness. A long-term happiness, it's work, it's family, it's those relationships, it's community, it's mindfulness. This is the stuff that we can really influence long-term that will give you better happiness. So 40% of happiness is based on isolated events. I'm craving that cheeseburger. I'm eating that cheeseburger. I'm happy. I want a new car. I bought a new car. I'm happy with my car. 3 years later, I want another new car. Well, the psychologists who work for the auto companies know this. And that's why people's leases are 36 months or 39 months, because 3 years later, I want a new car. 1 year later, I'm looking at other cars. I drove this Prius for 9 years, and I liked it. And living in Scottsdale, everybody has a nice car. And I'd pull into the gym, and I would oogle, and I'd look at all these Teslas and Mercedes and this and that. So I said, that's it. I met my finance guy. He said, spend more money. You're ridiculous. You're saving so much money. So I went out and got a Tesla. Now I pull into the gym parking lot, and I look at the Maserati and the Ferrari, and I'm like, I want one of those now. It's not fair. So it's called the hedonistic treadmill. The more you want, the more you have, the more you want. You have the Prius, you want the Mercedes. You buy the Tesla, you want the Maserati. It's just you keep going. You're trying to keep up with the Joneses, and you just keep going, and you get no place. So just a minute, because I found this really interesting when I was reading about this, daydreaming. We all do it. No matter how much you think you don't do it, we all do it. What's its relationship to happiness? So Killingsworth was a grad student with Gilbert, and he had this great idea for his PhD project. First of all, they don't call it daydreaming in psychology. They call it stimulus-independent thought, or mind wandering, okay? So he put an iPhone app on 5,000 people, 250,000 contacts with these people. Very easy questions. They got buzzed a few times every day. What are you feeling now? Are you happy? Are you somewhat happy? Are you not happy? What are you doing right now? What are you thinking about while you're doing it right now? 47% of the time during their waking hours, people are mind wandering. The nature of the activity had moderate effect on what they were doing. And what I love is that 27% of the time during sexual relations, people were daydreaming. Now, why would you answer your iPhone app when you're doing that is question one. And question two, I would never admit it. But people were less happy when they were mind wandering, when they were concentrating on what they were doing. So if you're concentrating on an intense task, you're happier than if you're daydreaming. So let's look at deep happiness and complex goals, because that's what surgery pretty much is. Trying to achieve a goal that are difficult but not impossible, okay? Helping people, healthy work-home balance is important. But these two, this struck me. This is surgery. This is what we do, okay? So I've tried a million times, and Peter Glavitsky, who's Hungarian, tried to tell me how to pronounce this gentleman's name. He was at the University of Chicago when he came up with this. I think he moved to Stanford, actually. He's a philosopher who talks about flow happiness, and it resonated with me as a surgeon. It's a complete immersion in a complex task, okay? You're motivated to do this by deeper talents, drives, and interests. And I love this because it's us, it's surgeons. It's described in people with a high level of skill who trained for years to reach the necessary techniques to achieve a high, difficult goal. That's what surgery is all about, right? You go through all that training, all that arduous, and you learn complex tasks, and you do them. So the concept of flow and flow happiness is people are happiest when they are engaged, when they're working towards a challenge that meets our level of skill. Okay, it engages us mentally and physically without overwhelming us, but sometimes doing that redo aorta, it overwhelms me, but it pushes me. It challenged me. It uses skills. It engages me. Doing that Whipple, doing that redo liver transplant. It's doing that difficult case. It's flow happiness. Spend a minute talking about money and happiness. The classic thought is that money cannot buy emotional happiness. You know, when one reaches a certain level of income, it doesn't matter how much more you make. And in America, that's $75,000. And this is what people believed. However, you know, there are two kinds of happiness. There's emotional well-being, you know, day-to-day life. I can go to Target and get whatever I want on my $75,000 a year. But there's a higher thought process, and this is called life evaluation. And this is, you think of life as a whole and what you've done. And this was kind of described by Daniel Kahneman, who won the Nobel Prize in economics. And he sort of married psychology with economics. He was at Princeton for a while. I think he recently retired. And he put it very well in one of his papers. He said, money cannot buy you happiness. Once you reach a certain amount of money, your emotional well-being reaches a plateau. So a few years ago it was $75,000. It's probably $80,000 now. But one's evaluation of life changes more positively with more money. When you put your name on the side of a building at Stanford, you have a little more happiness than the guy who's shopping at Target. It's just, Kahneman is right. It really does make a difference. Money does matter. And if you look at the average inflation-adjusted physician income, you know, this is going back 12 years. It's pretty high. If you look at surgeons compared to other medical specialties, and this is a few years old, but we're pretty high. We're not, and I know where I'm talking in Palo Alto, California, you're feeling middle class, a lot of you, but compared to the rest of the world, you're not middle class. You're making enough money to live a nice life. I'm an exercise freak. I feel badly because my exercise is screwed up because I'm here. So I'm not as happy. I'm losing my endorphins. But exercise makes people happy. Routine exercise makes people happy. Hearing that some of you bike ride to work 3 or 4 days a week makes you happier. So this was an article, and I just share this because I think it's really interesting. This is by a Dutch group. Exposure to body odor collected from people in a happier state induces happier responses in those who smelled the aroma. So I was like, how'd they do this, you know? So I read the article, and what they did is they showed people a happy movie, and they had pads under their armpits, and then they showed other people a scary movie, and they had pads under their armpits too. And then they had people who were blinded as to what they were sniffing, and they graded their facial responses to smelling the body odor. And if you smell body odor from people who are happy, you tend to smile more. And if you smell body odor from people who are unhappy, you frown more. So what I took from all this is if I go to the gym and I'm on the Stairmaster, I got to go next to some fat, sweaty guy who's laughing because it'll make me happier in the end. So take it for whatever it's worth, okay? So this is something, and this is a Greek philosophy, and it's eudaimonia, and it's people. It's sort of a theory about wellness and happiness. And happiness or good welfare, but more commonly it's called human flourishing. It's considered the highest human virtue. And let's talk about it. It's a happiness for what man strives. It's a contented state of happy, healthy, and prosperous, okay? So earned success, doing that hard case is important to long-term happiness. And success is not the key to happiness. Happiness is the key to success. If you love what you're doing, you will be successful. And it all kind of fits together. Happiness lies not in just having the money, it lies in the joy and the achievement and the thrill of the creative effort of making the money, of doing the big case, of doing it. So surgeon's happiness. We have a special relationship we develop with patients. It's the soul and pleasure of what we do. You know, you may not love every patient, but there are patients who just, you get along with them. You love it. You're in your office, and you're 20 minutes behind, and it's worth spending an extra 5 minutes talking to this patient because he or she is interesting. But not only that, you apply those intricate procedures that you've taken years to master, that push your talents, that yields long-term happiness. Doing the Whipple, doing the redo leg bypass. It's not like eating the cheeseburger. It's better. It's what we do. It's why we should be happy, and we underappreciate that. So in conclusion, eat the cheeseburger. It'll make you happy for a while. Hug your partner. It's really important. Watch the soccer game. Go there. It'll make you feel better as a parent. Do the difficult case. It really makes you feel better on the inside, and it lasts more than just in than eating a cheeseburger. But most important, be happy. Because really, at the end of life, you know, how many people care if they did the extra carotid or the extra cholecystectomy? They care about being happy. Thank you.